It has been 2 months since a video has been uploaded on Science Under 5 Minutes, and I am very sorry about that. But in that period of time, it was very hard to record any videos and it was tough to follow the schedule of uploading a video every week. So because of that, now Science Under 5 Minutes will be uploading 2 to 4 videos a month. So it really depends on the time we have. We may upload a minimum of 2 videos a month or a maximum of 4. So it could be a week with no video, but the next will have a video. So let's hope that we stick to that schedule. And without further say, let's start. Today's video is going to be about Covid-19, but not the disease, not how it works or not how it affects us, but how it's tested. And what are the chances of us getting a false negative or a false positive? There are many ways that you can get tested for Covid-19, and these could include an RT-PCR test, a salivia test, an RT lab test, and the antibody test, also known as the serology test or the normal blood test. Let's start with the normal RT-PCR test. The RT-PCR test works by first using the swab and putting it in the patient's nose to collect DNA. It's then put in something called the lysis buffer, where then it's put in the RT-PCR machine, where it will analyze and collect the collected DNA, and it will tell you whether you have an infection and whether it's Covid-19 or not. Next is the saliva test, and it's clear from its name. The saliva test is similar to the swab, but instead of it going inside your nose, it goes in your mouth to collect your saliva and analyze it to check if you have Covid-19 or any other infection. The saliva test is mostly used for children between the age of 3 and the age of 16. Next is the RT-LAMP test, and this test is very similar to the RT-PCR test, but instead it's way faster. It is conducted by collecting a nasal swab and placing it under equal temperature conditions. Results of the RT-LAMP test could be out within an hour. And next is the antibody test or the serology test or the blood test, whatever you want to call it. The antibody test is quite simple. All it needs is a pinch of your blood to be tested and check if you have an infection. These tests work by looking for antibodies in the patient's blood to determine if he or she has a past infection of the virus that causes Covid-19. Now this test mainly tells you if you have an infection or not, so the testing center will probably tell you to take a normal PCR test to have a more accurate result. Now, the most common test in most countries is the RT-PCR swab test, and these tests are not 100% accurate. While it is very rare for a false negative, it is possible for a false positive and a false negative. According to Professor Anthony Brooks, bioinformatics group leader at the University of Leicester in the United Kingdom, false positives can happen because of the methods used. Usually, beginning with a nasal or a throat swab and looking for a viral RNA, the test involves repeated cycles in which the genetic material is multiplied. As many as 35 or 40 cycles may be carried out, which Professor Brooks said is too many because it increases the chance of a positive result even without the coronavirus RNA being present in the original sample. Another lead of a false positive is that the person is testing positive because the sample collected has an RNA of the Covid-19, even though they don't have the virus anymore, but it's probably because they fought off an infection but still post remnants of the viral genetic material. Now for false negatives. A report by American and British doctors published this year in the British Medical Journal reported false negative results of between 2% and 29% for RT-PCR tests, and that's for false negatives. The sensitivity of Covid-19 tests rely on the type of test, place the test was taken, and rather if it was taken properly or not. That's it for this video. Thank you for watching. This was the first video in 2 months, and finally we're back. And again, as I said in the beginning, I'm going to try my best to stick to the at least 2 videos a month schedule. That's it for this video, and thank you for watching.